Okay, so for this online discussion, I'm going to be talking about two different managers that I've had while in my current position as a therapeutic rec assistant working in long-term care. When I first started, had one manager there, and considering the Ohio State studies, she was high on the task structure. She would assign us tasks to do, and then she would regularly come back. Have you done this yet? Have you done this yet? Where are you at with this? What do we need to do to complete this? Completing a task on a schedule was very important to her, with regular follow-ups. She was difficult to talk to if you had an idea for a new program. She took it personally that if you were suggesting a new program, it must mean there was a flaw or something missing in what she was doing, and she took it as a personal insult and would try and defend what we've done in the past instead of trying something new for the sake of trying something new. She's very resistant to change. She took it personally. If you had a new idea, it must mean that she was doing something wrong or missing something, instead of embracing the opportunity for something new. Also, she was a very negative person. If there was an issue with a staff member, rather than talking directly to that staff member, she talked about them with the other staff. All these led to very low work morale, although we achieved all our goals, all our tasks. People weren't really having very much fun and didn't look forward to going to work. The second therapist that is there now, the new site or facility supervisor, focus more on relationships, again, considering the Ohio State studies. She would start from a place of respect for all her staff. She recognized we all had experience, we all had specific training, and she trusted that we knew how to use those skills to do our job effectively. She gives us a lot more freedom. She's more concerned about, as staff, us being fulfilled and enjoying what we're doing, and she leaves us to choose the tasks that are more suited to our natural personalities and aptitudes. She's open to other perspectives, and so if somebody has a new idea, she's all for trying something new. Maybe it'll work, maybe it won't, but we won't know until we try. There's nothing wrong with what we've done in the past, but we can always try different, and different kind of keeps people excited and motivated in doing their jobs and doing it to the best of their abilities. When something comes up within the office, she'll have a private conversation with that person and talk strictly with that person about what is going on, and she doesn't discuss anybody else to other staff members. Overall, this leads to a higher work morale. We're consistently, regularly looking for new ways of presenting the programs we've done in the past and new programs that we are going to try. This keeps our residents more excited about our programs instead of doing the same stale programs we've done for years, because that's what we've done for years. An example of going back to the first therapist that I discussed, she's being very task-oriented. It is very important to her how we are perceived by other therapies within the department. And so although we would be responsible for writing SOAPs notes, progress notes about certain clients, before we could write them, we would have to write it out, give it to her to proof, rewrite it, let her reproof it, And we would sometimes have to do that 4 or 5 times before she would let us actually write it out. This was insulting, as a lot of times her suggestions were, she would correct spelling, but she would spell the words incorrectly. Or she would be using bad grammar. And you'd have to try and talk to her about why what she's saying didn't make sense or made things confusing, and she was not very receptive to that. The second therapist, staying with the example of writing SOAP notes, she saw how we were writing our SOAP notes. It was not in compliance with facility policy, and she did a staff in-service. This is how SOAP notes should be written in the future. She didn't go into detail about why we had to make the change. Just simply, this is now how we were going to do it. She did a staff in-service. She left it up to us to write our SOAP notes. If we have any questions, we go to her. But she believes that as professionals, we will use our professional judgment to write the best notes we can, and that they will be accurate and well done. If we look at the House and Mitchell's path for goal theory, the first therapist that I talked about was very directive. She was very hands-on management style, to the point that I would say she was micromanaging. She was all about the end result. She was not very supportive. She lacked supportive techniques to encourage staff to grow and to be the best they could. She wanted to make sure everybody knew she was the leader and we worked under her. She was participative in that she led programs. If we were doing a joint program, it was very important that she be the leader and anybody that was doing the program with her have an assisting role. She was highly achievement orientated. Within our department, any program we did, it was very important that it start on time, end on time, meet these goals, and that it be her department was seen by other departments as running with military efficiency. The second therapist that I've worked with, not as directive. Within the department, we've had conversations who's going to do what, and she leaves it up to us to ensure that we're doing our job. And she's very hands-off in that regard. She is highly supportive. If you have a question, a comment, a concern, a want, she's very easy to approach. She is highly participative. She enjoys doing programs. She wants to be doing programs and doing programs with her. She's comfortable taking on the assistant role and as rec therapy assistants, letting us lead a program. And her acting as our assistants as opposed to ensuring the spotlight is all on her as the leader. It seems like she's less achievement orientated. She's more focused on us as employees enjoying our work. However, although achievement and goals is not her primary focus, because we're left to do our jobs to our best, I find that overall our achievement actually has increased without her managing the department so tightly. I believe this is a more effective leadership style in that we're all adults, we're all professionals, and we all know how to do our job. And letting us have some freedom to do our job, we're doing it to our best instead of trying to meet somebody else's style of achievement, which is less natural for us. Thank you.